physician chiropractor, Dr. Gregory Johnson, and today we have Tristan here, who is 6 months pregnant, and this is her 10th treatment so far. So I'm going to show you today how we treat pregnant women, because a lot of pregnant women have back pain and leg pain, and they don't know what to do about it, and they're scared to get adjusted. But we'll show you, and I'll let Tristan tell you about it afterwards, how she's felt with us treating her. So we're going to analyze her posture just like we would any patient. So let's have you flex them head forward and backwards there. Now she has great range of motion, as you can see, and her head's coming up and back over her shoulders to where it's supposed to be. But looking at her from the back here, her head and neck is still translated a little bit to the right. We call that a negative SX cervical translation in BioPhysics terminology. She also has a little rotation. She's a side sleeper, of course, because she's pregnant, cannot sleep on her stomach. So, and back too. She sleeps on her back, don't you too? With your legs propped up, yeah.
Correct. Pillow under my knees.
Yep. But you can always tell which way a patient sleeps on their side and which way they turn just by looking at their posture. Okay, very good. So let's come over here then, Tristan. Now the first thing that we're going to do with her, because we cannot lay her on her stomach and adjust her for obvious reasons. Right here we got the baby boy. Boy, right?
Girl.
Girl, I'm sorry.
Got
the girl in there. Do you have a name yet?
Kendall.
Kendall, all right. So this is actually good for Kendall's development as well, because when we adjust the spine, especially down in the lumbar spine, she gets increased nerve signals to her uterus, and that helps the baby be more healthy and develop better. And this is really the only way that you can decompress not only a pregnant woman's spine, but most individuals' spine on the y-axis. So, and nice deep breath through your nose. Okay, I got one more here today. There it is. Good. Okay. First one didn't get what I wanted. The second one went all the way through, didn't it?
It did.
All right, good. And you can see she's still got good reflexes there. Perfect. Yes. Boy, that felt good.
That felt good.
Yep. That even feels good to me whenever they go that good.
My favorite part.
Yep. Now we have to do things a little differently than we do with our other patients who aren't pregnant, of course, because, like I said, she can't lie on her stomach. So, and this is the way we recommend most pregnant ladies sleep, by the way, which is exactly how I'm going to show you with her while I'm treating her. We want a pillow up here so that that keeps the space between her head and the arms that are touching the bed. You can bend those a little bit more, and then we're going to scoot you forward. There you go. So when you treat people who are pregnant, women especially, there we go, and you notice I bring her head back a little bit more. That way we increase the cervical curve here, her spine straight here, and she also has a curve now in her lumbar spine, the way that's supposed to be. And we keep her legs apart by putting this big pillow down there. And have you been sleeping like that?
I have.
Does that feel more comfortable sleeping that way?
It does.
Good.
Back hurts.
Okay, now we'll get that. Let her hold her baby there. He might be kicking up a storm after that adjustment. She might be, I should say. So we're going to work on her tensor fascia lata, as well as her gluteus medius maximus and piriformis muscles down here in the right sacroiliac region. And we come all the way down into the sacral region, and we're doing a vibratory percussion type of therapeutic activity here, which will increase the circulation and all the tissues affected here, as well as improve the quantity and quality of the nerve signals going to all these various areas. And besides that, feels good.
Oh yeah.
Yep. And you'll probably notice, especially if you're a pregnant female, that you get a lot of low back pain and leg cramps, and it's hard to sit for too long, stand for too long, or do anything really for that matter for too long when you have that kind of back pain when you're pregnant. We have several pregnant ladies coming to see us at this time that are about the same 6 months along, so it must have been a good winter here in Houston. There we go. Very good. So we got that side, and she already knows what to do. We're going to turn her over and do exactly the same thing on the other side. And if you notice, her head is back. She's really learning well, and she's keeping her spine curves normal, and that's exactly the way we like it. And that helps whenever she sleeps too. She don't wake up in back pain that way. Again, we're working on the tensor fascia lata. A lot of people call this the IT band, but it's very helpful in relaxing that muscle so that the pelvis, the sacroiliac joints, can stay stable and not being pulled on by muscle spasm or hypertonicity. And we work her entire spinal muscles up and down from her cervical, thoracic spine all the way down into her lumbopelvic spine region and pelvis. Okay, now that we have done our therapeutic activities on her tissues, we're going to move her over here and shoot her. That sounds mean, shooting a pregnant woman at 6 months, but this is a different kind of gun. Let's step back this way a little bit, that way everyone can see over there. Thank you. Okay, and again, we're going to have her do exactly the same thing she did initially. Go flex forward and then backwards. Great range of motion. Did that hurt at all? Great. It's okay. So she's still got a little rotation and translation, so we're going to fix that. See, her hands are right over her sides, though, so let's pull these up and back and flare these forward. We always show our patients the therapeutic exercises in mirror images so that they can help in the process of being realigned. Okay, put a little tap right here. And a little tap right there. Okay, good. Now, let's go ahead and relax. And flex your head forward and backwards again. Excellent. Very nice. Okay, good. Tristan, would you mind telling our YouTube audience how chiropractic has done for you with you being pregnant?
Oh yeah, it's been great. After I sit all week at my desk, my back is typically hurting, so it's definitely helped relieve that pain from being in the same position all day. So
yeah, good.
Definitely recommend it twice a week. It's been great for me.
Yeah, good. Well, thank you very much for letting us do the YouTube video on you. And thank you for watching. We'll see you next time. Bye-bye.